What is schizophrenia? To normal people, it makes people with the disorder look psychotic, insane, antisocial even. But to a neurobiologist, it's a malfunction in the brain, or overfunction you could say, where the brain interprets and alters a person's reality in a sense that pushes them to do abnormal things, see, hear, or believe things that others would deem crazy, and rarely allows them to live a normal life. It is often common to find schizophrenia in men and women between the ages of 15 and 30, and very rare to find it in children. Over 1% of the US population is affected by this mental illness, but treatments and medications are being developed to help schizos cope with their everyday life. Schizophrenia is diagnosed through a certain set of specific symptoms given off by patients. Hallucinations, hearing voices among the most common, delusions, movement and thought disorders, flat affect, or little executive functioning in the brain are all symptoms related to schizophrenia. These symptoms lead to different subtypes of schizophrenia. A paranoid schizophrenic. A disorganized schizophrenic. A catatonic schizophrenic. But where does it begin? Yes, in the brain, but where exactly? What goes on in the brain to cause these abnormalities? Through extensive studies and tests, neurobiologists have theorized that fluctuations of neurotransmitters in the brain cause the symptoms of schizophrenia. Glutamate, a main excitatory neurotransmitter, is said to be less active in the cortico-cocortical and extrapyramidal pathways, causing the psychosis and confusion being displayed by people with schizophrenia. Also, the flow of serotonin is increased in both the dorsal and rostral raphe nuclei into the substantia nigra, breaking off into the cerebral cortex, basal ganglia, limbic regions, and the striatum. Serotonin levels that deviate from the norm are thought to lead to the increased and decreased flow of dopamine to various parts of the brain as well. The flow of dopamine from the substantia nigra to the caudate nucleus putamen and the prefrontal cortex is increased, while the flow of dopamine to the mesolimbic forebrain and the tuberoinfundibular systems are decreased. This irregular flow of dopamine is said to be the fundamental cause behind schizophrenia. There are many theories pertaining to schizophrenia. None fully understand why it happens, but many understand how it works. Over the past 50 years, medications and therapies have been developed to try and help people with schizophrenia. Medications such as antipsychotics and antidepressants are introduced into the patient's system to help suppress the hallucinations and delusions so they can cope with their everyday life.
So the next time you hear that little voice in the back of your head, look into a mirror. Ask yourself,